Before the development of Western science and technology, herbs were the main medicine for the cure of disease. Herb shops are still common in China, and even here in San Francisco, this herb shop hundreds of herbs for the prevention as traditional medicine understood the relationship between body and mind, and the Chinese developed a form of meditation called Tai Chi, still practiced everywhere in China today. Because our modern Western medicine often treats men as machines, treating a part and not the whole, there's a new medicine now that combines these ancient techniques with modern technology to treat the whole person.
It's reordering your whole life, orienting yourself to using illnesses as opportunities for growth. Because we feel healing is really only when the personality is changed.
Healing comes only when the personality is changed. This concept of health as a symptom of a balanced personality and disease as a symptom of imbalance is the keystone of what has come to be called holistic health. Dr. Evarts Loomis, called the father of holistic health, defines it.
It's the balance of the physical, mental, spiritual person, where they're really in balance. Because you can't separate the physical, mental, and the spiritual, because we are one. Because if you have a headache, it's no chance. There are headaches in life that we better start looking into. Or if you can't stomach some food, you better find out what in life you can't stomach. Because only then, I think, do we really begin to find the meaning of what healing is really all about.
At Meadowlark, a sort of combination health spa and growth center, Dr. Loomis uses many of the techniques of humanistic psychology to bring his patients into touch with themselves, such as movement to music.
That we're turning to the study of health rather than the study of disease. Because I think today we in the medical profession are authorities on disease, and the result is disease is flourishing, I hate to say. So we must become similar authorities now on health. And this new looking at health would be looking at our person as a whole. This would be including the physical nature of man, which relates to our body exercise, relates to our nutrition, looking at the mental, emotional, how well do I communicate with other individuals and with all that surrounds me, and it also affects the spiritual, which is looking at the inner self, looking at the inner person.
Yoga and polarity therapy are part of the regimen. Also psychological tests.
We give all our guests a psychological test called the Taylor-Johnson test, which gives a pretty good profile of how much empathy do they have, how much anger do they have, just how they look at the world and how others see them. And it can be rather shocking to see how other people look at us.
To see ourselves objectively. In New York, Ilana Rubenfeld uses a variety of techniques to accomplish this, to help us see how we look to others and how we look to ourselves.
We are a oneness, we are a unity, but we only see ourselves in diversity. We're not skilled enough to see the interactions, because everything today is energy, and medicine has to get out of world of mass and matter and organs and parts and get into the field of interacting energy systems.
Ilana's emphasis is on the mind-body relationship.
We don't have one word for body and mind. We're still saying two separate words, and this is still an important issue, that body and mind really are in one place, that however we think affects our body, and whatever our body does affects our mind. In German, the word Haltung, H-A-L-T-U-N-G, also means attitude, posture and attitude. So we not only have body and mind, but the way we feel and think is expressed through a certain posture and attitude in everyday life. Yes, you really exaggerate it, so you really feel it, Susie. That's it. Really get it. Okay. That's where you live a lot of times. Okay? Now slowly let the neck, that's it. Let me guide your head and let the, that's it. Now take a deep breath. There you go. And that's where you could go. Can really only see a little bit.
Ilana uses the techniques of both Alexander and Feldenkrais and stresses the relationship of posture to emotions and vice versa. She helps Susie see how her emotions are reflected in her body. In San Francisco, Dr. Effie Poy Yow Chow teaches the Chinese approach to mind-body relationship. She shows how one person can affect another's energy flow, in this case, his ability to withstand pressure on his arms.
I'm not touching him at all. This is what Chinese medicine deals with, this energy system, in all its phases of health practice, in the philosophy of life, the positive philosophy of life, the meditative processes, nutrition, in martial arts, the exercises, the Tai Chi exercises that you all know, and in herbology, in acupressure, acumassage, and in acupuncture. This is the whole energy system which Chinese medicine is based on for 5,000 years. And again, in our present day New Age medicine, it is also utilizing the same basic concept. There are over 1,000 points on the body which exist on the meridian points and outside of the meridian system. And one of the major points that is used for relaxation and also any part of the body from the shoulder up, as far as headaches and sinuses and probably dental pain and relaxation of the shoulders and the neck. This is the Hoku point or Hapkuk point. And you find this point by closing the thumb and finding the highest point on the web here and pressing down until with the pressure hard enough so that Carol can feel an ouch point. Is that ouch? Okay. And you rotate this, and this is called acupressure. You rotate this, and it affects the energy channel, either opening up the energy channel so that your energy can circulate the body properly. Now, this is a major point for the upper part of the body. And the lower part of the body, from the abdomen up, we can use stomach 36, and you find it by putting your hand over the kneecap and finding the tibia, the large bone, and go off to the side, the lateral side of the tibia. And that point then, can you feel that? Yes, you find that. Stomach 36, and it is bilateral. This is bilateral, and this then you can press and rotate also for relaxation from the abdomen down. Now these 2 points are only 2 of the thousands of points in the body used for balancing energy. I will demonstrate the energy system by, Marcy, would you come up? How we can affect energy in the body by the use of the meridians. You can see the resistance of Marcy here, and I'll use her stomach meridian from the eye down to her toes. You see? All right, now I'll just go back the other way and affect the same channel, the stomach meridian. And you see I'm using, her resistance is back. I will use her spleen and liver, cut her spleen and liver meridian. You see, her energy is affected, and with heavy pressure, her energy is resumed.
Not just meridians, but thoughts, too, affect the energy flow.
Think of something depressing to you, very depressing to you. And when you get yourself in that state, put your hands up, your arms up the same way. something very sad for you. Okay, now think something really happy. Excitingly happy for you. Yes, you're very happy. And put your arms up. Okay, put your arms up when you're happy, when you're really happy now. Okay. Okay, you're back.
It seems there is one whole dimension of our physical bodies that we in the West have not considered. An energy system that can be affected by pressure as well as puncture, and by thoughts as well as things. At the Holistic Health and Nutrition Institute in Mill Valley, California, Dr. Rick Kozlanko uses an ancient Indian technique for tracing energy flow.
Right now we're trying to pull it all together. Now a bit of information that's important for me is to get a better understanding how energy flows in terms of your body. This can't really be done clinically, but there are other more esoteric methods of doing that. And there has been precedent set. There is the ancient method of pulse diagnosis, which is that of the Chinese, where they can tell the pulse balances between yin and yang energy. More modern version of that is the muscle testing, or kinesiology. A method that I like using, which works for me, is the ancient Hindu method, which utilizes the modality of a pendulum. Now, what I need from you is to have your hands open. These are entry and exit points for yin and yang energy with this particular method. And I'll be dangling the pendulum above your palm and be looking for a rotation. The kinds of rotation are distinct with left and right energy.
It doesn't seem to be moving.
Okay, let's look at the right hand. The right energy right now is going in a clockwise motion, and that's very typical of the right side, or yang energy. It's moving very, very strongly.
Pulse diagnosis, acupuncture, yin and yang energy. All these concepts of traditional medicine placed a good deal of emphasis on the responsibility of the patient. With the advent of Western technology, we began to depend more and more on drugs and surgery. Holistic healers say there should be a better balance between Western and traditional methods. At the UCLA School of Medicine, these ancient methods are studied under the direction of Dr. David Bresfer.
The ancient Chinese distinguished 5 classes of healthcare professional. Their lowest was the veterinarian or animal doctor. Second was the acupuncturist, who used moxibustion or acupuncture to treat only specific illnesses. Next was the surgeon, who treated much more serious, life-threatening kinds of illnesses that may have followed, for example, traumatic injuries. Second highest was the nutrition doctor, who taught people what to eat. His was the medicine of longevity. But the highest physician of all was the philosopher sage, who taught people the order of the universe. You see, according to the Chinese, he was the only physician that could effect a genuine cure, because he went directly to the heart of the problem, which was the person's inability to live harmoniously with the laws of nature. Now, the acupuncturist or the surgeon today might prescribe nutritional or medicational kinds of therapy. The philosopher sage might prescribe, on the other hand, something like 4 hugs a day. That may be more therapeutic than anything else we could offer.
4 hugs a day or the equivalent thereof. That says a good deal about energy flow and interacting energy systems. The lady in green on the left is Dr. Leni Schwarz, an environmental psychologist who lectures and leads workshops for pregnant couples to help them understand how important their feelings and attitudes are to the unborn child.
And I'm interested in the patterning of childbirth and what happens between the conception and birth, the process of childbirth, because it's in that way we are shaping the next generation. It's from the point of view of the baby, that new person coming into being, that I feel we must concentrate on. in what we give and what we feel and who we are to ourselves, we are imprinting on the new person that we're bringing into the world. So in working together, we're really bringing to the surface all of those attitudes and all of the conditions that create new life, not only in the body, but in the culture. I'd like you to say the name of the person to yourself as often as you want to. Give that person the identity they have, and transmit your positive feelings to the person that you're massaging, and get a sense of who they are and how they hold themselves and where they hold their tension, and see if you can relieve it.
The objective of all such exercises is to become aware of the importance of feelings and attitudes in health, in this case, in the health of the unborn child.
And then slowly come to rest and withdraw your hands back to yourself. And notice the difference in your own body and your own feelings. And be aware of how the circle feels now and how you feel toward the two people that you've been close to.
And it gave me such a powerful feeling for both of you.
A lot of the techniques that I'm using come out of the human potential movement and have to do with meditation and body work and building trust and looking at the dependency that occurs at this point of life. But trying Gestalt techniques, role reversal, psychodrama, all kinds of things that allow us to get beneath the surface of the anxiety that may be building, and also to form support groups and to be able to express love and affection non-verbally. I had two women and a man and two men that I think we get a different sense of what that communication is about.
Interesting.
It's the development of family life that's being worked at in such groups, getting at the fears and the anxieties between men and women that are hard to talk about. Birth is a very sexual event. We all have difficulty talking about our sexual responses and being as dependent as we need to be. And this is true for men as well as women. And beginning to loosen some of the layers, the surface layers of those feelings, brings out a sense of how magical this time is.
Dr. Milton Estes, seated by Leni, is an obstetrician who also stresses the importance of the parents' attitudes and emotions.
Because in attending childbirth over the past few years, both in the hospital and at home, I've had the opportunity to see how important the psychological, spiritual, magical quality of childbirth is, and how childbirth can be tremendously influenced by a couple's attitude and relationship and preparation. And I feel that it's extremely important that people have a chance to allow themselves to explore the psychological aspects of what is going on in their pregnancy in becoming parents. We have developed a series of childbirth education classes, which I hope to expand even further, which goes beyond the usual educational role of teaching women and men what goes on in labor per se, but we also go into great depth in terms of nutrition, and we do a lot with body movement and yoga. Basically, we try to encourage intimacy and trust so that people can share feelings, talk about anxieties or relationship problems, all the things which come up with tremendous frequency during pregnancy.
Give each other a big hug and just share non-verbally what we've been talking about together as a group. And say goodbye. Who would like to get into the center?
The concepts of holistic health are not new to the world. In Connecticut, the Integral Yoga Institute has established a clinic that combines the best of the East with the best of the West. For yoga has for thousands of years emphasized the interaction of body, mind, and spirit.
Okay, just let him know.
Dr. Sandra McLanaham is the head.
Here at the Integral Health Services, the aim is
to provide not only service to the community, but to document the benefits of the yogic practices in both treatment and prevention of disease. By using a team approach, we try to integrate a holistic view of the person, and we include in our staff medical services as medical doctors, nutritionists, chiropractors, physiotherapists, psychotherapists, and childbirth counseling. The main aim is to provide a view through this team approach and a treatment of the body, mind, and integration of the individual with his true self so that he can know his spirit, so that body, mind, emotions, and spirit are all approached in the yogic way.
Meditation, a traditional path to the balance that results in good health, plays a key role with cancer patients. A year ago, Margaret Keating of Greenwich, Connecticut, was told she had an inoperable cancer of the pancreas. This usually means death in a matter of months. She began meditating, in the beginning using tapes supplied by the Cancer Counseling and Research Center in Fort Worth, Texas.
Began to turn loose of the tensions that have built up over the day. Began to become aware of the tension in the little tiny muscles around the eyes and the muscles around your jaw.
They were developed by a young doctor named Carl Simonton. While he was doing residency training in radiotherapy at the University of Oregon Medical Center, Dr. Simonton noticed that those cancer patients who did unexpectedly well always appeared to be positive in their attitudes. He developed a system of meditation and visual imagery specifically for cancer patients and founded the Cancer Counseling and Research Center. His success has been encouraging and raises many questions. When Margaret is completely relaxed, she uses another tape to help her visualize a healthy pancreas.
The cancer cell is a very weak, confused cell. It only grows when the host, when our bodies are weakened. The normal healthy cell, the normal healthy body, rejects the cancer cell. We destroy cancers thousands upon thousands of times.
She and Dr. Simonton both stressed the fact that one does not rely solely on this method. One continues with chemotherapy or radiology or whatever one's doctor has prescribed. But Margaret puts her mind and imagination to work to speed up the healing process. She visualizes strong white blood cells devouring the weak cancer cells and uses other forms of imagery.
Life. Having more energy, better appetite, better able to relate to the members of your family and members of your community. Become aware of your goals, the things that are important to you.
Margaret's response has been gratifying.
See these things very clearly.
But how does one move from what is considered normal health into the vibrant energy the holistic healers are talking about? At the Psychosomatic Medicine Center in Oakland, the emphasis is on optimum health, and Dr. Kenneth Pelletier, author of Mind is Healer, Mind is Slayer, uses biofeedback to help the client realize that the mind itself can be trained to do most of the things that mind-changing drugs are used for. The instrument he is using helps the patient detect levels of muscle tension. High levels of muscle tension are a common denominator in many psychosomatic illnesses. Learning to keep relaxed under the constant stresses of life may add immeasurably to one's joy in living.
Many of the people that come into the clinic who don't have a specific disorder, but really simply want to learn how to work in their lives more effectively. We've taken a number of readings of your blood pressure and heart rate, and brainwave activity, peripheral circulation, and now what we're going to look at is your muscle tension. And I'd like you just to become quiet, as though you're relaxing at the end of a day. And I'm going to determine how effectively you do that. And later on, you can learn how to do that even more effectively and enter into a state of relaxation that would enable you to alleviate any stress situation and prevent a more severe disorder. Now, Now, whenever you hear that tone, the high-pitched tone means that your muscle tension is increasing. The low-pitched tone means that your muscle tension is moving in a decreased direction. What I'd like you to do is just try to become quiet, maybe close your eyes, and listen to that tone, and try to determine what you do internally to move that tone downward. Good. These instruments enable us to show a person how their mental states affect their own physical functioning. What's more, we can extend that one step further and have that person learn internal methods of being able to regulate their own heart rate, their own blood pressure, and to prevent more severe disorders from occurring. What this enables us to do is to begin to explore the realm of health. We know a great deal about pathology, and we're beginning to find out about states of optimum functioning, where people can move from a state of normal or average health into states where they can live and function at levels of performance that we thought to be impossible before. And this is probably one of the most exciting areas that we're working in
More
right
than
now.
50% of Dr. Pelletier's patients learn to think the sound down. They can't explain how they do it, but they do it. Then, after intensive practice, they can do this on demand without the machine.
Remember the physical sensations and mental sensations you had that enabled you to drop that muscle tension lower. These are the sensations that will allow you to use this when you're away from the clinic, because there's no need to become dependent on the instruments. They're only a mirror.
Biofeedback is one small step toward greater awareness. It points straight to the greatest mystery of all, the ability of the mind to control its own and the body's sickness and health. On a working farm in a quiet valley in Wisconsin, there's a pain control clinic run by this man, Dr. Norman Shealy, a neurosurgeon who has given up surgery. Patients, most of whom have had numerous operations with no relief, come here as a last resort.
Really feel like what you want to accomplish. Great. Okay. Well, you know, when patients come to the center here, the first thing we have to do is be certain that the diagnosis does not include anything else that needs primary treatment. Now, in your case, we know that that's true, so we don't have to worry about it. 99% of the time, when patients come in, they're almost doubled up with pain, as you've noticed. But actually, we know that patients have within themselves the ability to control the pain if they will only work with the techniques that we use here.
And they are many. Simple techniques like daily exercise and massage. More complex techniques like electrical stimulation and biofeedback. In the beginning of their 2-week stay, patients are a bit bewildered by the sophisticated equipment they must learn to use, but that's over in a couple of days, and they actually begin to enjoy the hours they spend each day programming their mind. Okay. With biofeedback, they see the temperature rise as they think warm hand. When they realize that their thoughts have done this, then they are ready to move into using the mind to control pain and restore health. First, the patient must become relaxed.
Every breath, as you breathe out, say relaxed, over and over and over again. I am relaxed. And if your mind wanders, it's okay, but bring it back again and again to the words, I am, as you breathe in, relaxed.
When the patient is completely relaxed, the imagination can do its work.
Create an image of yourself being projected back in time, 2,000, 2,500, 3,000 years ago, back to the ages of the most famous healing temple of all time. See yourself standing outside this healing temple. walk in and see yourself meeting the priests and the physicians who will be working with you in this famous healing temple. And you begin to feel this life force. You begin to feel it flowing into you. Begin to feel it inside of you, something beautiful. You begin to move further.
Patients spend hours each day learning to relax and to think of brain as computer, mind as programmer. They are simply reprogramming their biocomputer, aided by suggestions on the tape.
In 60 to 70% of our patients, back and leg pain are the presenting problem. But this is really no different from cancer, insomnia, peptic ulcer, or rheumatoid arthritis. They all have major personality disturbances. The striking thing about these personality abnormalities is that they're totally reversible, sometimes within 2 or 3 weeks. As the patients learn psychophysiologic control of their bodies, their minds, and their emotions, as they give up their resentment, their fear, their anger, and their guilt, then total healing can occur. Associate with. Feel this force inside, maybe pictured as a golden light.
The new medicine often sounds like the old religion. What amazes most of the patients is that it works. 90% are greatly helped in the 2 weeks here, and 72% are permanently helped. Dennis Wood was one.
Well, I've had back problems for a lot of years, I guess basically since I was 18 or 19 years old, and over that period of time I went to a variety of doctors and clinics. I went to a rehabilitation clinic in Illinois for a while, and finally reached the point at about age 40 that I was so concerned about my problems, occasionally having to have my wife help me get out of bed in the morning, that sort of thing. I was very worried that by the time I was 50, I would be starting to become incapacitated, and it was beginning to really bother me. I came to Dr. Sheely, went through his pain clinic, and really as a result got pretty much of a change in my attitude, kind of worked things out to the point where I understood better what my situation was and that I could control it, and simply feel very much better as a result.
Patients begin to realize that this energy can flow from one person to another. It can carry thoughts. It can heal. It's a manifestation of love and caring. And when they begin to feel it and develop positive, creative goals, the healing powers begin to flow. These principles are really the basis for healing in almost all illness.
The new medicine is more than a marriage of traditional and Western. It adds a new emphasis on mind as healer, mind as slayer. Biofeedback pointed the way. The holistic healers are on the path. With the realization that the brain is a supercomputer that will program anything the mind sends it, we could enter a new age free of disease.